Centers for Disease Control and Prevention, 90,000 to 100,000 Americans are affected by sickle cell disease. My name is Snyder, and I'm going to talk about sickle cell anemia, the effects of it, and how to treat it. First, we'll look at exactly what sickle cell anemia is. Okay, what is it? It is the most common form of sickle cell disease. The body makes sickle-shaped red blood cells, whereas normal ones are disc-shaped and the sickle ones are crescent. And the body produces an abnormal hemoglobin in red blood cells. They are also known as hemoglobin S, and that stands for sickle. And they live about 16 days. The normal hemoglobin is also known as hemoglobin A, and it stands for atypical red blood cell, and lives approximately 120 days before replaced. And this is a normal red blood cell, and it is disc-shaped. This is a sickle-shaped red blood cell, and it is shaped like a crescent. Okay, what is it? It is an inherited gene or disease. People who have this disease inherit 2 genes for a sickle hemoglobin, one from each parent. In the U.S., all states mandate testing for sickle cell as part of their newborn screening. Doctors may even be able to diagnose sickle cell disease before birth by using a sample of amniotic fluid or tissue from the placenta. National Institutes of Health states sickle cell disease occurs in approximately 1 out of every 500 African American births and 1 out of every 36,000 Hispanic American births. Also, 1 in 12 African Americans carry sickle cell trait according to SCDAA. Now that we know what it is, let's look at what it does to the body. This is a diagram of how it is inherited. 1 in 4 are affected, 1 in 2 are healthy carriers, and 1 in 4 are uninfected. Okay, some of the effects of it: it blocks blood flow, organ damage, raises infection risk, sudden pain throughout the body, and also people with sickle cell grow more slowly than other children due to shortage of red blood cells. And here is another comparison picture of the red blood cells. This is a normal one, and this shows like a closer kind of picture of what it is. It's a cross section of a red blood cell, and it has the normal hemoglobin specks in it. This is the abnormal sickled red blood cell, and there's a cross section of sickle cell, and it has abnormal hemoglobin formed strands that causes sickle shape. Okay, signs and symptoms: fatigue, shortness of breath, dizziness, headaches, coldness in hands and feet due to blood not being able to flow freely due to blockage, and then jaundice. Okay, and up to this point we have learned what it is and what it does. Let us look at some of the treatments for this disease. Okay, so how do we treat it? There is no widely available cure. Treatments can relieve symptoms and treat complications. There's also the blood and marrow stem cell transplant, and it may offer a cure for a small number of people who have sickle cell anemia. Infants are treated with antibiotics to reduce the risk of infections, and severe sickle cell is treated with hydroxyurea, and it prompts the body to make fetal hemoglobin. Okay. And this is another picture of the sickled cells, and then there's the normal ones. And then here is a microscope slide of a sickle cell red blood cell. Okay. Sickle cell anemia is a deadly disease. There are many effects from this disease that are detrimental to the health of those affected. Having a better understanding of this disease, the effects of it, and some possible ways we can treat it help us to live a longer sickle cell free life. Do y'all have any questions?
Yes. Why did you want to do this speech over this topic?
One of my really good friends is a carrier of it, so she has the trait of it, but she does not actually have the disease.
Okay.
Yes.
How do you know if they're a carrier or not the disease?
Like I said, the newborns, they test their blood and they can tell. Anybody else have any questions?
I have a question.
Yes, ma'am.
One of your slides it was a J word. What is that? Like the
Jaundice?
Yeah, what's
It's
that?
a skin color, like it has a yellow, like newborn babies sometimes get it, and they have to be put in the light, and so it's kind of like a yellowing of the skin. Anybody else? No? Okay. Thank you all for coming.